Thanks for having me. So, yeah, I'm originally from, southeastern Indiana, about halfway between Louisville and Cincinnati. Notice I said Louisville, not Louisville or Louisville. If you're from the area, you'll know. But I'm from about halfway between Louisville and Cincinnati. I went to undergrad at a small school in Indiana called Franklin College, just south of Indianapolis. Didn't know what I wanted to do when I graduate. I've done all different kinds of things since. The steel mill and the Raptor rehab and things like that. Those were summer college jobs, but everything kind of fills in to play a role.
Yeah, my mom is from Kentucky and yeah, it's Louisville, whatever. I'm not even from there. That's a whole different conversation. But
I
um
tell people,
yeah, go
I tell
ahead.
people say it like you got mashed potatoes in the back of your mouth. That's what always helps me to say it right.
Say it in the most southern, like a person from Washington trying to impersonate a southerner, all of the consonants, and then add a couple extra vowels. Because my dad always jokes, it should be Louisville, or Louisville, it's after King Louis, and I'm like, but it's not. It's the same thing as Bear County, Texas, Bexar, Bear, whatever.
Oh,
Did you always,
that's that Cajun French.
but anyway, did you always know that you wanted to become a vet? You said you didn't know what you wanted to do after college. Was it always something you were interested in and you didn't think you could do it, or you didn't want to do all of the extra school, or what kind of brought you to the field?
Yeah, so when I was a high school athlete and wanted to play collegiate athletics, so one of the things that Franklin College, a Division III school, offered me was the ability to play two sports. So I played football and baseball for part of my time there. Thought I wanted, when I was applying to schools and things like that, to be a crime scene technician. I came from a very police heavy family. I've got an uncle, two cousins, my dad, my great uncle are all police officers. So it was kind of going to be my way of joining the family business, but obviously to be in vet med, you got to be a little science heavy, and that was going to be my way of contributing. But I saw my first dead pig up by Purdue in 101-degree August heat in Indiana, and did not handle it very well. So, as I'm sure you both are aware, going through anatomy and later necropsy rotation, you will understand that you're not quite sure how I went from hating seeing a dead, decaying pig in August to being a vet, but we'll get there. So I changed my major technically 7 times in undergrad, but they were all around central things. So I went from like a chemistry major with a sociology minor to a sociology major and a chemistry minor, switched to like secondary education with a chemistry background, and then switched to like a pre-med track, thinking I wanted to be an anesthesiologist. And then actually, I took a field biology trip when I was a third year, when I was a junior, to Louisiana. We went down to Houma, Louisiana, and we banded ducks down there. We did a lot of different field ecology things, and I fell in love with biology and thought I wanted to research animals. So when I say that I didn't know what I wanted to do when I graduated, that's not 100% truthful. It's just kind of the easiest way to explain it. I wanted to be an ecological researcher of sharks, and I wanted to network my way into that, but I made that decision so late in my undergraduate career that I never had the ability to speak with people with master's degrees, and it's really hard to go from central Indiana to the coast in Florida or wherever and be able to network your way into those kind of ecological impacts. So, um, I thought I'll apply to the Disney College program and do the Disney College program, which, for those that don't know, a Disney College program, you give up a semester of your undergraduate education and or summer, and you can do this up to a year after you graduate. So in theory, if you graduate, you can do it for the following fall and then stay through the following spring, and that's what I did. So I did what they call the Fall Advantage program, where I worked the summer and the fall, and then I technically extended into the spring, but discontinued my contract because I got the bird training job down there. That process of a switch is mostly because I fell in love with zoos and aquariums while I was down there. I found the importance of how they connect people to animals, and I think that's what I wanted to do when I was looking at ecology. Is I wanted to connect people to sharks. So Shark Week happens every year. Mindless man-eating monsters. Oh my God, there's a shark in the water. Things like that. And I wanted to counteract that stigma as much as I could. And, I never made it there, but that's okay. I changed paths on my own and decided I wanted to become a zookeeper, animal trainer. And from there, I networked my way into Steve Martin's Natural Encounters Incorporated. They're the ones that do the bird show, the free-flighted bird shows at Disney World. They train the birds that do the free-flighted bird show at the Indianapolis Zoo, a couple of other places. So I worked with them for 6 months, and at their advisement, because it was a seasonal job, I should apply for a dolphin training internship in the state of Hawaii at a place called Sea Life Park. They had two trainers there that had previously worked at Sea Life Park. So I applied and I got accepted, went out there, did an unpaid internship in the state of Hawaii for 6 months. It was a little tight. Thank God I had one of my dad's high school buddies that lived out there in Mililani and let me crash on his couch. Worked out there for 6 months as an intern. Got hired on afterwards because I had the rehabilitation center between my junior and senior year. I worked in their seabird rehabilitation center as well, rehabilitating albatross and brown boobies and, all of those kinds of things. And then decided after I met my wife, so her family has 9 veterinarians, including myself, 9 vets in the family, that I wanted to go to veterinary school. So after spending time in their clinics, I thought that's what I wanted to do, and did a small animal job and then an equine job, and moved states a couple of times. And I'll be honest, my grades weren't where they should be when I was coming out of undergrad to get into veterinary school, so I had to do the master's program at Lincoln Memorial University. They have a master's in veterinary biomedical sciences, which is a fancy way of saying if you don't get into vet school, there's not a whole lot you can do with this degree. So I was lucky enough to matriculate into the vet school, spent an additional 3 years there, and then did a bunch of rotations with them not having a teaching hospital around Lexington. I did a rotation on Saratoga, a rotation on Ocala. So made my way around, and then, as you mentioned, an intern up there. So that's kind of the natural flow of how I went from no interest to in veterinary medicine.
Family made you feel confident enough?
Shout out to Leonard Badig in Northeast Ohio. That's my father-in-law. It took him 3 applications to get into the Ohio State University, and it also took me 3 applications. So it also took me an additional degree, but as it didn't take him the master's degree. But, he made it a lot easier because he's owned his business since they graduated in 1985 in Northeastern Ohio. It's a 2-doctor practice. He and my mother-in-law up there, they service their underserviced community. They've got a referral practice just down the road so that if there's anything that they don't feel like they can do, I mean, let's be honest, I graduated in 1985. Big dogs are a little strong now, so they'll refer those guys. Or if there's an ultrasound that they think they need to be done, they just have practiced without an ultrasound since the 80s, so they refer those cases to places that have those options. But they made it really easy on me to be able to self-reflect that it's okay if you don't get in the first.
Definitely. We just had an episode on gap years, and then we did another on somebody who had failed or not, I don't want to say failed, but they failed a test that made them repeat their first year. It's not abnormal to have to repeat or fail or etc. And we talked about it last time, but I failed my OSCE at the end of first year. And it was awful. It sucked. It's fine. I retook it. I passed. Woo. But my point was, I failed the OSCE after that interview, and during that interview, I had said, and I'm going to repeat it again, you don't understand that it can happen to anybody, and it can be from any kind of reason. If you don't get in, a million different reasons why. And also, I don't know what the current stats are, but 2 years ago, the national acceptance rate was 14%. So you are in the majority if you don't get in. I wish more people would kind of take that into account, because all you see is people celebrating. It applies to everything in life, not necessarily just vet school, but you see people celebrating. Nobody posts about not getting in. So you're like, well, everybody is getting in. Everybody is passing their OSCE. Everybody is doing this thing or having this good thing happen to them. But, nobody's going to show you the harder parts. So.
Well, and to that point, Gretel mentioned in the opener that I want to be a large animal equine surgeon. I know we'll talk about residency a little bit later, but the large animal residency path is one of the most competitive paths there is. It has a 10% match rate when you average the equine surgery and large animal surgery programs together. So with a 10% match rate, out of every 10 applicants, only one gets in. And it's not to be like, woe is me. It's just a difficult path that people choose. And I saw this past year when I did not match for the second time. Well, I matched last year. That's how I ended up here at the University of Missouri. But I didn't match for the residency. When I didn't match for a residency for the second time, one of the things that was really hard for me for that first 24 hours or so, because you understand going in with a 90% unmatched rate that there's a pretty good likelihood that you walk. But obviously you've done everything you can to put your best foot forward. But it's really hard to see a bunch of the intern mates that you knew or that you have met along the way, even some of the externs when I was interning that did match. It's hard in the moment, but you're right. Nobody talks about the failure, but I think one of the things that taking a gap year or failing the test or not getting in the first time really teaches you is that resiliency, that it's going to be okay, even if you don't end up where you want to be or with the job that you want to. And I know that we were talking before the podcast started about, you got to find the place that you can live with whatever protocol they do, whatever culture they have. Every place has its own crap. You just got to find the one that you can live with.
Yeah, and I definitely, so remind me, I want to go over the basic structure of like, what is a rotating internship, to residency, blah, blah, blah. I just want to go over basic structure because up until maybe October of last year, I did not know a thing about it, and I know a little bit more now. And so I want to kind of cover the basics on that.
I've explained the post-graduation path that I have chosen enough times that it will sound like I've rehearsed it. So we can definitely hit that later in the podcast.
Yes, remind me of that. But taking a step back, obviously you did a million externships for LMU with the, what do they call it? The distributive model, where they don't have a teaching hospital, so they send you out.
12.
A million.
12.
I said a million. It feels like I've already done 12. I haven't done 12, but I also do a ton of externships in my spare time. I'm on one now. I do Christmas break, spring break, summer break. Any chance that I get, I go back out because I don't have a lot of clinical experience, so I'm trying to make up for that. But I wanted to talk about something I've been trying to think of a way to address since I kind of started with all these externships. So, for example, my first one was last December, and I happened to end up at a great clinic, and they were great to me, but nobody tells you. Maybe they do in school, but before school, what the heck do you do? Like, you show up. I remember I didn't take a lunch for the first 3 days because I was rotating between doctors, and they were like, oh, you should have taken a lunch. Like, they take lunches at different times. And I said, okay. Like, do we have any tips to give people for when you're going into internship, externships? Like, what do you do? How do you approach it? I think the best advice I've come up with is to go in with, like, depending where you're going to, 3 to 5 simple, achievable goals that you can do at that clinic. So, for example, one of mine a couple months ago was I had never done a blood draw. And I said, I want to get decently comfortable with taking blood or placing a catheter. And so I went into that clinic. I said, I want to work on this. And then we did so. And then sometimes they can't necessarily accommodate that. Like, I went to one a month or two ago and I said, I want to really get good at blood smears. And then they said, well, can't really accommodate that. But, whatever. So do you have any tips for going to all these different places? Because it's easier to know the expectations when you're only doing internships your 3rd/4th year at one school versus going all over the place and learning different cultures and different environments.
Yeah, I think one of the important things you said there is set achievable goals. That's always good no matter where you're at. Even if you're at LSU's teaching hospital and you're going on your internal med rotation, if you want to work with a neurologist real closely and get really good at neurological exams on your small animal patients, make that one of your goals. And you may not have the opportunity to do that on clinical cases, but a lot of these schools have the ideas of, okay, we can round on that, and then you can ask your questions and you can go home and practice on your dog and show us what you're doing and make sure that that makes sense. I've done that with my students. Working in the large animal side, we've got a task checklist on the food animal side that they have to complete. And on the equine side, it's very similar, but you've got people who haven't been around a horse all that much. So they have to learn to practice a blood draw on a horse, or when I'm on surgery, if it's a well-behaved patient and they can do a diagnostic nerve block, I try and let them do that, where I'll do it on one side of the leg and then let them do it on the other. But I think going in with those goals is really good. I think something else that is really hard if you're not used to going to externships or you're not used to working multiple jobs is that this is maybe not the best saying for a veterinary podcast, but there are 1,000 ways to skin a cat, and one is not more right than any other. So what I mean by that is you may go to a practice where they do their physical exams nose to tail, and that's kind of how you're taught. Or at the same time, the next practice you go to, they do them tail to nose. Doesn't make it right, doesn't make it wrong. They both have examined every portion of the animal, but that's just what that doctor is comfortable with. You know, one of the things that I learned here at the University of Missouri is that they do a lot of their equine arthroscopies in dorsal. And in my previous internship at Rood and Riddle, Saratoga Springs, they did almost all of them in lateral, unless it was like a hock or a carpus or a stifle, right? Something higher up on the limb, which is facilitated better when you have a hoist to be able to flex and extend the leg. But like a fetlock, we did all of those in lateral at Saratoga Springs I can't even think of one that we did there. Whereas I've been a part of 2 fetlock arthroscopies here at the University of Missouri, and we did them both dorsal. Doesn't make one more right than the other. It's just what each clinician is used to. So try both of those when you're out on those externships and see which one works for you. You know, and I think finding out the expectations that they have for you, being a good communicator and using your professional skills that we get really good at with clients in veterinary school, but we don't get it quite as good at with our attending clinicians. I've seen people struggle with that with me. I felt myself struggle with that with my attending clinicians, both when I was an extern, when I was an intern. So, you know, I think talking with them and trying to set realistic expectations of, do they expect me, since I'm in the last semester of my 4th year, to basically be a functioning doctor with a little bit of oversight? Or are they going to be more hands-on? Or if you go to one of the big Lexington equine practices, they may expect you just to stand there, hold the wall up and watch, and then help clean up after surgeries. You know, like, just in discussion with them, sort out what their expectations for you are, manipulate your expectations for them based on that, manipulate your goals for the rotation based off that, and then, you know, try as hard as you can. But, you know, I went into one of my clinical rotations of, this is the place that I will get an internship. That was my mentality. I am going to force the buck that this is where I'm going to do my rotating internship. And it didn't happen because I tried too hard. And what I mean by that is I went above and beyond in my mind, but was obviously trying too hard in their mind. And it set me up for failure is probably the wrong word, but failure of the goal of trying to get a rotating internship there. It set me up for failure. So I think that open communication with practices and the open communication with your clinicians is really, really important. And LMU's gotten really good at setting their students up for success by working and developing really good relationships with clinics and what they expect their students to be doing on rotation there. I don't know LSU or Mizzou or UC Davis or any other school's mentality and relationship with other practices and what they can do and allow students to do with different practices. So I think that conversation may also help with that particular situation going.
Do you think that your background helped you prepare to go to a bunch of different practices because you've seen so many different sides of the field? Where Michaela and I were talking about it because we're both traditional students, and she mainly worked in necropsy, and I've done raptors and horses mainly. So I feel very open-minded, but that's not how everyone feels.
Yeah, I don't know. I think that, so my first small animal experience that wasn't like my in-law family side of practice was a very negative experience. It just didn't set me up for success very well, where what I thought I was doing and was hired to do and what they hired me to do were 2 totally different things. And the work environment there felt fairly toxic. So like, that's why I moved on from that. And I really held it against small animal medicine for a very long time. And it's not fair to the industry or anything like that. I still have problems with small animal medicine, but I've come to terms with the first job I had being a problem, not the actual industry. But I think I really wish people would keep an open mind, especially going into equine practice. I'm sure that you've heard these AAP statistics repeated a number of times. I saw you guys talked with Dr. Rhonda Rathgaber recently, and I'm sure she talked about it. But
Yeah, she's great.
she, the AAP in 2019 came out with a study that equine practice is one of the lowest that people go into, and it's something like 4.4% of all veterinarians that graduate go into equine practice at some point, and 50% of those have left equine practice in 5 years. 2.2% of all graduating students, now granted, classes are getting bigger and we're trying to put more emphasis on underserved areas for equine practice or for large animal practice. But speaking from a large animal perspective, having students that keep their minds open and, okay, maybe this is something that I can do and I'm willing to do, that completely changes, I think, the mindset of the student and whether or not they enjoy rotations, even if they don't think they do. So, I think that students being set up for success and keeping an open mind, I think that also helps them with the NAVLE, and I think that helps them in the long run for vet school. And who knows, you might find a job you actually enjoy. There's a food animal practitioner here who mostly does our ambulatory practice, Celeste Morris, who went into vet school not having any food animal experience. She's from Memphis, Tennessee. She's a small animal through and through, and now she's a board certified bovine theriogenologist and basically runs the ambulatory food animal department. So, keeping your mind open and experiencing might set you up for a career that you actually enjoy better than what you thought. I went in initially thinking that I was going to do exotics, and after being up in Lexington and seeing the practices there, I knew it was like the holy place of equine practice. But at the same time, thinking outside the Lexington bubble can be hard once you're ingrained in it. So it's really changed my belief system on that quite a bit.
What specifically about equine practice made you want to join? Did you not grow up with horses? Because that
No.
itself is very difficult to approach.
Yeah. So I did not. I married a horse girl. You'll see a theme developing here about how my wife has affected my life in more ways than just marrying me. So I married a horse girl, and I was really struggling with that first job that I mentioned earlier. And she was like, I really think you would enjoy the equine. So I actually called in sick one day when I was with the small animal practice and went and worked with the equine practice for a day, and he offered me a job that was better paying. Hours were cut a little bit, but was better paying, and he was willing to take the time to teach me on people's horses, on people handling skills. I had ridden a nose to tail trail horse when I was like 12 twice, and like that was the extent of my equine background and knowledge. So yeah, I didn't get much of that until after, and a lot of what I've done has been on the job learning, some for good, some for bad, right? Failure is a great teacher. So, I got involved with it because of that. Now, why equine practice? I think the things that we can do with these animals is so cool. Plus, I grew up an hour from, Lexington, or an hour from Louisville, 2 hours from Lexington, just north of horse country, in the bluegrass. So I really fell in love with a thoroughbred racehorse even growing up. Barbara was kind of like my heart horse on TV, which doesn't make sense because your heart horse is supposed to be something that you have in your paddock out back. But he was the one that I remember really connecting me with it, and it's been 20 years, I think, since he died. 18 years since he's died, something like that. So for those that don't know, Barbaro won the Kentucky Derby. He went to the Preakness Stakes, and fall started, broke through the gate early. They were able to pull him up. They did a vet check on him, and the vet cleared him to race, that he was okay. They loaded him back into the gate, and before he even made it to the first turn, he broke one of his metatarsus bones one of his proximal phalanx into 28 different pieces. Just completely blew his leg apart, which, for those that remember our anatomy, no foot, no horse, no leg, no horse, right? But from him winning the Kentucky Derby and being in Maryland, there were people that were willing to try. So they took him to the new Bolton Center where they did a pastern and fetlock arthrodesis and basically created a implant. If you haven't seen the radiographs, there are pictures online and they are wickedly cool, but at the same time crazy. He started to get over the broken leg, it started to heal, and then he got support limb laminitis. They were able to get him through that first bout of support limb laminitis, and then he developed it again, and they had to euthanize him due to the support limb laminitis. So he was one of them that really connected me with the sport, one of them that really connected me with horses. And after seeing some of the cool stuff that they could do there in Lexington, I decided that I wanted to do equine surgery. I'm fairly good with my hands when it comes to cooking or, working with wood or whatever. Like in my background, I've done all of these different jobs that I've had to do with my hands. So, I think that that's really guided me to both equine practice and even further to equine surgery.
That's an amazing story. I think a lot of people grew up with horses. I grew up on a horse farm, and so did McKaylin. So I think we can attest. I didn't get my first horse till I was 14, and he was like a 26-year-old, half Arab, and arthritic as hell. And so I had to do everything to keep him alive. He also had Cushing's. Figured that out. And a laminitic little mini donkey that someone gave me all for free was not free.
As I'm sure you learned from that experience, the cheap part of buying a horse is buying the horse. The upkeep is the expensive part.
Exactly. How did your understanding? So I got my first horse to train ever a couple years ago. She was a research horse at the vet school at Illinois. And she's just a mess. I mean, now she's great. So that free part was not free at all. So I trained her mostly and then sent her off as well and went to the trainer and learned a lot about behavior and communication. Did that help you, like your dolphin training experience and your bird training experience with horses, or completely different system?
I will acknowledge I may go off on a gigantic tangent here. So
go for it.
When I was trained as a dolphin trainer, I was trained by one of the guys who worked at SeaWorld in the 90s. And SeaWorld in the 90s, whether you love or hate the corporation of SeaWorld, there are plenty of people on both sides that I cannot convince to go the opposite direction, so I've given up trying. But they did a lot of behavioral research that is now backed by a lot of psychological sciences or is rooted in psychological sciences. So we used the science training in our process. And I saw it work firsthand with the dolphins. I've seen it work again with my dog back here, who you probably heard a minute ago, and every once in a while I'll catch my wife doing it to me because, like I said, we were dolphin trainers out there together. So if you can train one animal, you can train them all. You just have to find what is reinforcing and what is aversive and when to manipulate them, because that's what it comes down to. And one of the things that I've frequently had to remind myself and then catch myself reminding students is there are prey animals and there are predator animals, and what is reinforcing, what is aversive are two totally different things to those animals a lot of the times. So when we talk about predator animals, your dogs, your dolphins, your even birds to kind of some extent, a lot of the times positive reinforcement is more accepted and more utilized with them. And for those that don't remember Psychology 101, positive reinforcement is the addition of a stimulus following a behavior to increase the frequency of behavior. Whereas with our food producing species, our horses, our prey species, for them we tend to use negative reinforcement or positive punishment as like a starting gate, and then can follow that up with some sort of positive reinforcement. So again, for definition purposes, positive and negative refers to the addition of a stimulus or the removal of a stimulus following a behavior. Enforcement and punishment is whether or not we are increasing or decreasing the frequency of said behavior. So when I say negative reinforcement, what I actually mean is the removal of a stimulus following a behavior to increase the frequency of behavior. Like, hold on, that doesn't make sense. How does that happen? The example I often use with people is when I was training dolphins, we had a hierarchy and in our pod. And we had one matriarch named Alaka. She's a retired Navy dolphin. She was 50 odd years old, and she ran the show. If there was a loose dolphin and you had Laka as your program dolphin, you didn't have to worry about that dolphin coming over to your group. Whereas the low man on the totem pole was a male dolphin, Atlantic bottlenose dolphin named Mickey-Oy. If you've ever seen the movie 50 First Dates with Drew Barrymore and Adam Sandler, so that was shot at Sea Life Park, and the Mary-Kate and Ashley dolphin are actually two male dolphins called Mickey-Oy and Kaleo, so he's one of those two dolphins. But occasionally, Mickey-Oy would refuse to gate. So what we would do is we would send Laka out to the pool that Mickey-Oy was in while keeping the gate open. So he was able to escape an aversive. So it's the removal of a stimulus following the behavior that will increase the frequency of him gating. Okay? Does that make sense? If we were to close the gate, that is the introduction of a stimulus following a behavior to decrease the frequency of him refusing to gate. Okay? So that would be positive punishment, which in our zoological species, and arguably any species that isn't your own animal or child, because I guess this also applies to child rearing, is unethical. As much as I have worked with Gretel over the last semester and a half, I wouldn't come over and, punish her dog by smacking it on the butt. Okay, that's not my role, and B, I don't want to be the person that's known to go around to people's houses and spank their dogs. So, whereas giving them the opportunity to escape that, that's a way to manipulate the behavior while not utilizing positive reinforcement exclusively. Because I think that's one of the things that people often get away from is like, I'm going to train my dog using only positive reinforcement, which is a perfectly fine way to do. Problem is you're not working as efficiently as you can. That also means you're not going to take any timeouts. So once you start a training session or once you start working with your dog, you're going to continue to work with your dog the entire time because a timeout is a negative punishment. The removal of a stimulus following a behavior to decrease the frequency of the behavior. So as how that relates to horses, it's one of the things that I have to constantly remind myself because they're prey species, right? So they are very reactive to changes in their environment. So when we change something in their environment, people talk about pressure as they're training their horse. I'm sure you're familiar with this. Both of you being horse people or being on horse farms, they're talking about putting pressure on, taking pressure off. So putting pressure on is utilizing their flight zones. And I talked about this in clinical skills. See how much you remember. I talked about this.
Don't test me. I do remember this though.
So as you walk up into their flight zones, right, they naturally should move away from you. So that would be a form of a positive punisher that you're using their reflexes to step away from you as a tool in training. So when we have horses that don't load on the trailer and people want us to help, right? I was initially trained on the thoroughbreds where all the yearlings, you just grabbed them, like you linked hands behind them and you pushed behind them and they stepped onto the trailer. Not all quarter horses, not all warm bloods, not all draft horses that we have here in Missouri were trained that way or know that way. For them, sometimes you have to bait them on with some grain, or sometimes you have to, I saw one have to get, pushed up with a broom behind them, use the broom as your kind of positive pressure point to have them step away from. But as you have them step away, as long as you don't continue the pressure on, that's a form of negative reinforcement because they're stepping away from the pressure, they're stepping away from the aversive. So I think it's something even I still have to be very mindful of, but I think it has helped in that process. Bird training, not quite as much, just because it was a very, very learning experience that I didn't know what I didn't know in that moment. And the more time with the dolphins, I was able to gain more of a grasp, and they were able to teach it in a way that I understood it a little bit better than initially with the birds. And that's nothing to say against Natural Encounters Incorporated. They treated me very well. It's just I didn't quite learn as much as I probably should have in that moment.
Well, one thing I wanted to bring up. Okay, well, first, let's do this. Walk us through you graduate vet school. If you are interested in becoming a specialist of any kind, what is the general generic process? And what year do you start doing this? That whole thing.
I understand your question, but I don't think there's a clear answer. And the reason I say that is because I gave this big long talk about keeping your mind open, but the sooner you start with your connections, or if most residencies require research experience, the sooner you start with the research experience, the better letters you get, the more closely you work with people. So there's this whole game with it. But the way that it works for a lot of residencies, I understand this is a veterinary podcast, but just in case there are any listeners out there that aren't veterinary medicine inclined or don't know about the specialty process.
That would be like Michaelin's grandma or my cousins.
Okay, great.
Yeah.
So day one after a veterinarian graduates veterinary school, they can go out and they can do whatever they feel comfortable doing. Technically, if they feel comfortable going out and anesthetizing a horse and doing an arthroscopy, they can do that as long as they have a owner that's willing to pay for it, and as well as they have the comfortability and understand the liability that comes with that. Now, with that said, that's not all of an common occurrence. So the way that I usually explain it is, Gretel, the day that she graduates, or Michaelin, when the day that she graduates, they can spay your dog, they can neuter your cat, they can do a splenectomy, they can, insert decently common thing here. That's a big difference from human medicine. Human medicine, when they graduate, they often have to do at least one, if not two internships, and then they have to match with a residency program. So in veterinary medicine, if you want to do those more advanced procedures, so a TPLO in a dog, or a colic surgery in a horse, or get really good at understanding the reproductive tract of cows, and that's not to say that there are people who aren't board specialized that can't do these things. I've met plenty of people who aren't. But a lot of the times, to decrease your liability and as well as get really good at these procedures, people will often specialize into some sort of like orthopedist or surgeon or something along those lines. And for small animal medicine, they work very closely in surrounding what is called the match, or the VIRMP, the Veterinary Internship and Residency Match Program. So the VIRMP is a system that was set up based off the human medicine match process. And applications usually open around November 1st, with most places putting their programs into the match in October. So application opens November 1st. It's often due for all of your application information around the end of December, beginning of January. And then there's this big long interview process where schools will contact you, or places will contact you, and then you rank all of the places that you've applied, 1 to how many ever you're willing to go to after this. And then the programs rank who they're willing to offer the job to. And a giant computer algorithm takes, okay, this place is willing to offer this person first. Are they on their list? Yes. And it matches you up with programs. Okay, I can really dive into this longer, but I don't know that it would actually be beneficial to this podcast, or at least this part of the conversation. Equine medicine, a lot of clinics want the ability to be able to control more of the process. So they work outside of the match a lot of the times for private practice internships. So Root and Riddle, both in Saratoga, Lexington, and their Wellington branch, Haggard in Lexington, Brazos Valley in Texas, Ocala Equine Hospital in Ocala, Peterson and Smith in Ocala. All of these places work outside of the match. So they have their own application process that have letters of recommendation and a statement of intent and blah, 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 blah. So you apply to them, and your start date is variable based off whenever they decide or whenever you agree. Whereas with the match, it's very decided. So how does that affect? Sometimes you have to cut internship short. Sometimes you have to delay the start of your next internship. I was very thankful the University of Missouri is willing to let me go about a week early so that I can actually get moved to Ocala before my contract starts down there. But it creates this whole mess of problems, as much as they like to have their hand and their pick, which makes sense, right? And then there's the residency, which, at least for equine medicine or equine surgery or the large animal side of things, they work more hand in hand with the match. There are a couple of private practices that have residencies for surgery outside of the match. Root and Riddle in Lexington, Root and Riddle in Wellington, Steinbeck in California. I'm trying to think what else off the top of my head. Palm Beach Equine, Peterson and Smith. Those places, Rhinebeck. There's another one in Kentucky that just opened up in Simpsonville, just outside of Louisville. That name of that practice escapes me. But all of these equine practices, some of them are outside of the match, but a majority of them are inside the match. So again, you have to apply to this process and go through it, and that's what allows you, after a residency, which, depending on where you get it and what program you're in, can be anywhere between 3 to 4 years. I haven't heard of any 2-year programs or 5-year programs, but I guess in theory there could be. There is talk about taking the surgical residency programs for the large animal species and increasing them so that they, instead of 3 years, are 4-year programs to give you an additional year to gain research experience. The problem with that is that the ACVS requirements is that you get all of your cases done in 3 years, so it's not like you can add cases in that 4th year. The ACVS, for those that don't know, again, is the American College of Veterinary Surgeons. They're the ones who make the board exam and set the requirements and what you need to be able to sit for board exams, things like that. The process for residencies is quite in depth. It definitely takes some time and some preparation. It's not something that you can do within the last month, but it's going to be very similar to your application process for veterinary school of collecting letters of recommendation, writing the statement of intent, collecting your transcripts from veterinary school, filling out the general application process, and things from there. So it's not too far from what applicants that are in veterinary school have been used to throughout this process, if that's something that they want to go into. But I would talk to people and advise people about, only doing a residency if this is what you can see yourself being happy for in the long run. Internships, very hard. Often underpaid, not always, but often underpaid, often overworked to the bone. I've seen small animal ER people upstairs or talked with them about their previous internships where they have been on for what feels like near 24 hours. When I was in Root and Riddle, we had a dystocia after a colic surgery. So we were dueling beds, and I worked the full day before and the full day after. So it was hectic. Yeah, but it comes with the territory, right? You know what you're getting yourself into. Internships are hard. Residencies are hard. You have to complete a research project in addition to all of that. Sometimes you have to teach students, depending on where you're at as well. Easy, Gretel. You were fine. It's one of those things that if you're just doing it to be like, I think I could do that, it may not be for you. It might be something that you want to explore a little more before you start to go down that pathway, and maybe do a rotating internship just to be able to understand what all is involved with your specialty before you start getting into the residency.
It just sounds so intense. I even feel as I just finished my first year. It feels very far away. I think a lot of our class don't know exactly, but it's not that far away.
Especially for you guys here, sorry to interrupt you, but especially for you guys here and Mississippi State, where it's like a true 2 and 2, or close to a true 2 and 2. Technically, Missouri is like a 2.11, 1.89 or something like that. But nobody cares enough about the decimal places. We just round to 2 and 2. So, in those kinds of situations, you guys have all of your didactic classes crammed into 2 years, and you go longer, or you start earlier and end later in those 2 years than most other veterinary schools. So your ability to go do externships in those first 2 years is decreased. You have to be able to manage the information as well as talk with people about research opportunities if that's something that you want to explore as a veterinary student a little bit more. But you're halfway through your didactics. You personally are halfway through your didactics. So it's one of those where it's closer than it appears, and you really have to, if that's something that you want to do, and there's definitely no pressure from me, but no pressure from really anybody else except for the goals that you set for yourself, to meet them, and anyone can do it. If I can come as far as I have, I'm now technically the most trained individual in my wife's family of 9 veterinarians after doing 2 rotating internships. So it's one of those where you have every opportunity to meet the goal and meet the bar. It's just you really have to have your ducks in a row to really set yourself up for success without having to apply to the match multiple times, up to 3. There was somebody who interviewed for the large animal surgery residency at a school in the Southeast that did 6 1-year internships last year. Last year is when they interviewed.
Wow.
The fall of 24 into the spring of 25 match period was when they interviewed.
That's insane to
And
me.
only 3 chances.
Yeah. Blowing our
it depends on how bad you want it, right? If you're willing to, take the pay cut in the short run and maybe deal with the application process and deal with what comes with being a intern for 6 years, makes perfect sense to some people. As I said, if you're not going to be happy doing anything else but being a surgeon, do what you got to do to be a surgeon.
Yeah, similar to vet school, a lot of people take multiple tries but it's the only thing they've ever wanted to do and it's worth it in the end. Um,
Yeah.
this is just a step up from that. I would wonder why, if I was in that position, why I wouldn't take a job as a non-boarded surgeon at just maybe an equine hospital or something. I don't know. Do you see what I'm saying? Like, why would I not? I'm sure there's a reason. I just don't know. That way to get the pay and not be an intern and then still, you completed those internships, but then you would get the pay, except.
Yeah, I think it's hard as somebody who had a job and then went back to school. It's hard to leave money on the table, to go back to living off student loans. Oh, the average starting salary for equine practitioners coming out of veterinary school is $85,000 a year. So obviously, that individual has significantly more training than a recent grad coming out earning 85, but it's hard to go from 85 back to a resident salary, which can range anywhere. The lowest one I saw was $34,000 a year this year. Up to Ohio State has 54 this past year. So,
Yeah.
it all depends on what's important to that individual in that moment, what they think sets them up the best for their next application if they're willing to keep going. That might have been their last one. I don't know.
You didn't want to do a residency. How could someone gain experience in surgery?
In like large animal surgery?
All of the above. How about that?
Yeah, so I think working closely with either a board certified individual or working closely with somebody who has done it for a while. So I'll give you an example in Lexington. Michael Spirito, who works at Haggard, he is not technically a board certified surgeon. I believe he is residency trained, but did not sit boards when he was done, or he might have also completed, before there was a residency track. Whereas, there are the guys that the newer grads that have come out, Cole Sandow, who also works at Haggard, or Bryce Freeland, who are board certified. So like the interns and even the recent hires at Haggard, working closely with them, I think would help them in that process. In the small animal world, I don't know how common somebody who does a lot of surgery that isn't board certified is. So I can't really comment on that. When I was in Washington State, between my time in Hawaii and my time in Tennessee, there was a traveling orthopedic surgeon that would come around and would do some of our TPLOs, or we had I think there was a Blue Pearl and a VCA within driving distance in Seattle or Tacoma. So, I don't know how common it is. I mean, we did a leg amputation there. I actually worked for a Mizzou grad out there. And, she did a leg amputation while we were out there. And, she seemed comfortable with it, at least comfortable enough to be willing to try it. So I think understanding and explaining yourself to clients as well, even if it's not something that you're like comfortable doing, but being like, look, I've read about this procedure. You have no option to do something else, then it might be something to where you take a risk and do it anyway, right? Cover yourself when it comes to, your liability.
Yeah, I had a couple points. First off, you mentioned things within driving distance for opportunities. It gets more complicated when I always use this example, but I'm from somewhere where, like, the closest place that my dog could have gotten chemo is a 4-hour drive. And so when you're in situations like that, I haven't quite solved that. I think you either have to make some sacrifices and essentially move or make that drive every day, or you need to go without and make the most of what you can in your current scenario. Those are kind of the two options because you can't make something geographically appear. So people ask me for advice like, how do you get experience when either the hospital in your hometown doesn't accept you or da 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 da? I don't know. Like, to be honest, you either have to make a drive or you need to move or you need to do what you can with what you have. I don't really have a whole lot of, and I grew up in that scenario and I was like, you can't make a hospital appear in your area or your region. You just can't. Maybe pray for it. Like, that's all I know.
I was just going to say to that point, though, was my mom is always like, you can come back to Madison, Indiana, and you can open a large animal practice here. And I'm like, Mom, if it was profitable, somebody else would have done it. So, like, that's the hard part with those, is a lot of the times these underserved areas struggle with veterinarians because people are leaving with such high student loan debt, or it takes so much money to start a practice, or, you know, something along those lines, that they don't see profit in a long enough time period that they can't. They can't do it financially. So, you know, and unfortunately the clients and the patients suffer because there's no way to get around that particular thing. But if you can't keep the doors open, it doesn't matter.
Yeah, that's a whole different conversation, but I just wanted to bring that up because I had been asked that. We talked about the residencies and the internships and the externships, and it was kind of on the same topic. Well, how do I get large animal experience if I live in the city? You're going to have to go somewhere. Like, unfortunately, you can do these 2-week, 3-week, 4-week. A lot of companies, especially corporate, will customize it, however long, and leave your city for a couple weeks. For example, I'm in Texas right now. I live in Louisiana for school. Like, I have to leave to get some of the experiences that I want to have. And it's just a sacrifice you have to be willing to make, or you can go without. That's fine too. No pressure. But if that's something you feel passionate about. The other point I wanted to talk about is I ended up, like I said, I did not understand or know. I knew that, like, I had worked in the necropsy lab and there were residents, and that's all I knew. I never thought too much past it. I never even considered that a possibility for me, because I was like, I'm not interested in that, whatever. Well, I started considering it back in maybe October, November, and I said, let me look into this. And you mentioned the match program was open, and I had opened the website. I was scrolling through, looking at the pay, and I noticed that, so obviously there's pros and cons to both. I didn't know if you had opinions, but the general trend I saw was, if you go to a private practice as an intern, resident, whichever, you make more money, but maybe your opportunities or caseload is a little different than if you go to a university. But then if you go to the university, you're getting paid 30 to 50 range is what I saw. But private practice, I was looking at like 80, 90 range for the same job, different things. I didn't know if you had any advice or opinions. Is one better than the other, or just completely different?
I think they each have their own can of worms, and one is not better than the other. Obviously, I'm viewing this from a large animal perspective, where probably 80% of our residencies are through the match program, and a lot of our internships aren't controlled by the requirements of the match, so they have different standards. But with that said, I think that you have to almost treat them as two different styles of achieving the same goal. So, like, your caseload, depending on where you're at, depending on what your hospital's really good at, because, like the University of Illinois, as an example, does the most arthroscopies of any academic institution in the country. So, the University of Illinois is really good if you want to be an equine orthopedist. Whereas, even the University of Illinois doesn't hold a candle to the amount of arthroscopies Rood and Riddle does. But people are sending their horses to Rood and Riddle for those surgeons to do the arthroscopy. They're not sending it for Dan Thurston to do the arthroscopy. They're sending it for Larry Bramlage to go do it. Or they're sending it for, whoever else, right? So how do those guys square their residency programs? That's above my head. That's above my pay grade. That's above my knowledge. I don't know. But, I think that academic institutions, things run a little bit slower, but they're designed for teaching. So you may be better prepared for boards if you do an academic institution. But at the same time, if you're able to really develop and really be self-motivated in your private practice residencies, I don't see why you can't succeed just as easily, if not better, in those private practice residencies than the academic institutions. So each one's got a trade-off. I was actually talking with Dr. Sam McClanahan, who is our first going into second surgical resident here at the University of Missouri, about his caseload. And he's like, dude, I'm golden for right now. He said, I actually took a lot of time off. I'm almost exactly at a third of all of my cases, or a little above. He's like, I think I'm done with ophtho surgeries, but like a little behind on arthroscopies, but I'll catch up with those by the end of the year, just based off how we're usually busy. So, every place is a little bit different, and what you have to square, what you can live with and what you can live on are also something that you have to square. It might be ramen noodles and bologna sandwiches for a little bit. That's what my mom used to tell me that I would have to do. And I've come to terms with it slowly. So, it's one of those things of like, if you're somebody who cannot eat the processed meats or cannot eat the processed foods, and because those are cheaper, maybe a private practice that's going to pay you the 80 to 90 might be a little bit better, and your work-life balance might be a little worse, which also, I hate that term because that would imply that there isn't work-life balance if you don't have good work-life balance, but it's just a term thing. It's not actually like a problem with the concept. So, I think that one is not better than the other, and there are 1,000 ways to skin a cat from going to point A of a vet student to B, a board certified.
Well,
what would you say to your younger self? And then actually, we should end on the really, really fun one, Michaela. No, let's do our normal one.
Okay.
What would you say to your younger self first, or any veterinary students or pre-vet students listening?
Hang in there. You've got a lot going against you right now in general, with all of the instability of student loans, with all of the instability of higher institution, with all the instability of science, with all the instability of, everything. But it's all turned out okay so far. It will all turn out okay going forward, even though it doesn't seem like it will, and it seems like the world's burning around you, or that, you got a C on your first test and you've been a straight A student your entire time. Hang in there. Okay? You've made it this far. You'll continue to make it. And it doesn't feel like it. Those feelings are okay. But at the same time, you'll become a better doctor. You'll become a better student. You'll become a better individual by hanging in it.
Yeah, that's great advice. And for our last question, when we remember, we always ask, what's bringing you joy today?
Oh, God. I actually had the day off today. Yeah, I know. For those that don't know, we're recording this on a Tuesday. The University of Missouri has developed their ER ICU rotation for our equine students, at which the person who works our evening shift from 4 to midnight and then stays on call for the hospital from midnight to 8 a.m. gets Tuesdays and Wednesdays off. So I was off today. I got to sit around and do a whole lot of nothing except take my state licensing exam for the state of Florida, which I passed. So I can now officially be a veterinarian within the state of Florida. But yeah, hoping to find a house and go down there and, ready to be down in Ocala.
Nice. Well, thank you for joining us today. And thank you, everybody
Thanks for having me.
who's listening. And we'll see you next time.